This week's subject is antibiotic stewardship. Antibiotic stewardship was designed to ensure that patients receive the right antibiotic at the right dose for the right time and for the right duration. And it is believed that by monitoring these antibiotic therapies closely, we can reduce antibiotic resistance, we can reduce C. diff infections, we can reduce the cost of health care while improving and increasing good patient outcomes. And antibiotic overuse is contributing to the growing problem of C. diff infections and antibiotic resistant infections throughout healthcare facilities. And by improving antibiotic use through this stewardship, interventions and programs improve patient outcomes and also save money at the same time. And by improving antibiotic use, we need to look at medication safety as well as patient safety. And it is common to see patients that are treated with antibiotics have adverse reactions to these medications. And it is believed that lots of times that these medications are prescribed when they're not really needed, and therefore we're increasing the patient's risk of having an adverse reaction without them getting any benefit from clinical outcomes through getting the antibiotic. And it's believed that 50% of all antibiotics prescribed in an acute care hospital are either prescribed inappropriately or they are unnecessary, meaning they were never needed to start with. And misuse of the antibiotic increases these adverse reactions in the patient, the risk for it. It increases and leads to C. diff infections. It adds to the growing problem of the antibiotic-resistant infections, or bugs, as many people call them. And according to CDC, there were approximately 23,000 deaths each year, 23,000 deaths annually due to these resistant infections. And as nurses, the things that we can do is like when patients come into the hospital, lots of times they may be treated for sepsis or pneumonia, and it's very important that we get the antibiotics started right away. And so as nurses, we can ensure that all cultures, blood work, all of those things are done prior to starting the antibiotic. And we can, as we're reviewing these medications nightly or daily on our shifts, we can pay attention to, once we get the cultures back, if the physician's aware these cultures are back, and the potential need to change from these empirical antibiotics to something that is more suited for that specific bacteria that grew out in the culture. And oftentimes in our emergency department, we have patients that come in that are telling us what kind of antibiotics they want because they feel like they have an infection, that it's not allergies or just a common cold, or even when they had the flu, they thought that they needed to be treated with antibiotics. And it's very hard to get the public to understand why physicians are not prescribing these antibiotics as readily as they used to, and to make them understand of how it can hurt them versus how it could help them feel better. And when oftentimes we'll have a patient leave upset, and an hour and a half or 2 hours later, another local ER will call for their records, and they're there trying to get an antibiotic. And it's going to be very important that physicians practice consistently, and that we as healthcare givers are providing the same information repeatedly so that it gets through to the public, so they understand the dangers of overusing antibiotics or not using them correctly. Like when an antibiotic has been prescribed for something, it's important that they take it exactly as directed and complete it, and don't just stop taking it in a few days when they feel better, but it's important that they complete the entire dose, because these are some of the things that are believed to have led to these antibiotic resistance from not completely killing the strain, and then it comes back stronger. So there's a lot of education that needs to be consistently done by nursing, by pharmacy, and by the physicians in order to get this message out to the public and to help them understand why it's important and why we don't always need antibiotics. Because we live in a society where we believe that when we go to the doctor, they can just write us a prescription and we can take a pill and feel better. And sometimes it just takes time to feel better. There's no antibiotic to cure the common cold or an allergy or the flu. And it's just going to take a lot of consistent education and all of us sharing the same exact message time and time again.